And about this morning. Where are you today, Brianna?
Good morning. We are at the Food Distribution Centre of Inner City Helping Homelessness. Now, there's not many people whose lives this hasn't been, there's not many lives this hasn't been affected by the COVID-19 pandemic, but what is happening to Ireland's homeless? Now joining me here is Anthony Flynn, CEO of Inner City Helping Homelessness, at a safe distance.
Yes.
Good morning to you. What's happening behind us?
Well, this is our Glasnevin food redistribution centre. The food that comes in here comes from the European Feed Grant and is allocated to us from Food Cloud. This food all right through the year is allocated to people that are living in poverty or people that are in homeless services. So what happens here is generally we bag up this food into food provision parcels. Those parcels are distributed to people that would be living in poverty right across the city at the moment.
So we're seeing a demand not just from the homeless but also the elderly and people suddenly out of work.
Yeah, we've seen a massive increase, a treble in the amount of people that are actually looking to access our services, and demand is absolutely huge. In terms of those that are looking to access, we're seeing people that wouldn't normally be looking for service in terms of food provisions, and we're seeing people that are being let go from their jobs, in particular the elderly and the vulnerable and people that can't, I suppose, leave their homes, and people that are fearful of the fact of COVID-19 and the pandemic that's going on at the moment. So what we're trying to do is reach as many people as we can and ensure that they are supported and that they have the likes of the basic food provisions that they need.
And there is one small silver lining to businesses closing down, and that's that many have supported you by donating what's being packed behind us.
Yeah, definitely. Over the last number of days, the increase in donations from businesses right across the city, and businesses that I suppose have been decimated by COVID-19 have donated their surplus foods to us. We've seen companies such as Google and other big companies who have directed their catering towards us that can be redistributed through the Hostel system. So we've seen an amazing increase in the amount of people that are donating, and that will ensure that those that do need to get it.
And what about those sleeping in hostels? What are you hearing on the ground? How are they practicing social isolation, social distancing?
Well, we've got a bit of a crisis in terms of the hostel system at the moment. What we have is we've up to 90 people that are still sleeping rough on the street, although the ICHH are working to try and get as many people in as they can. The hostel system is not the correct environment for social distancing. It's very hard in terms of social distancing. When we have 70, 80, 90 people in one unit in one building, it's very hard to enact a social distancing practice. And I suppose anybody then that would need to be put into social isolation is going to be even harder. We have been in contact with the department and the DRHE in regards to opening facilities like hotels and having one room access for people that do require that.
And if someone who is homeless is presenting with symptoms, what can they do? Where do they go?
So guidelines have been issued in terms of people that are homeless, because many homeless people don't have a GP. Safety Net are working with organisations and ensuring that tests are made available to. The DRHE issued guidelines to the homeless service units yesterday in terms of, and basically we go through the HSE for a test, but in regard to confinement and stuff like that, it's very, very difficult, and we have a lack of rollover beds and 24-hour access to the hostels at the moment, so people are sporadic within that system, so trying to ensure that all of these people are looked after is very, very difficult at the moment.
And just back on those hostel opening hours, many are nighttime only, leaving people out on the streets in the daytime, and they often frequent cafes, libraries, warm places. Those places are now closed, so what are they doing in the meantime?
I suppose a lot of the avenues in terms of where people would have went through the day have closed down. As you said, libraries and so forth, and basic areas that people would access. A lot of people are just wandering the streets at the moment. We have been in touch with the DRHE. We're trying to liaise in terms of ensuring that all hostel facilities operate on a 24-hour basis. But staffing those facilities at the moment, there's been a major increase in the amount of people that are accessing the hostel system, particularly since COVID-19 has been formidable. So it's a case of basically trying to turn those units into 24-hour systems, and there's a lot of pressure on the system in order to do that at the moment.
And what about families in emergency accommodation, those families in hotel rooms, suddenly their children are off school and they're stuck in a small room basically? What's happening to them?
Very difficult, and even trying to get out in terms of getting a shop done. We're seeing this panic buying right across the city, which is leaving vulnerable people, such as the elderly, and people that are stuck in confinement, maybe in hotels or self-isolating in hotels, unable to access basic food provisions like this. So I suppose we're ensuring that those supports are available. But in terms of hotels, we need to ensure that all of those units that are available to families are on a 24-hour rolling basis, and that everybody that needs access to those units are getting them.
And And your street team's also been impacted. You've got volunteers dropping off, obviously afraid to get out there and to come into contact with someone with COVID-19. How can people help?
Well, I suppose what we've seen is a reduction in volunteers over the last number of days, and you know that's expected. We haven't reduced our service in terms of our frontline service, and our outreach support services are being maintained. You know, and we want to reassure those that are listening, and particularly anybody that is homeless, that our outreach support teams are on the streets. But we need those people to come in. We need those people to be accessing the hostel systems. We've had to reduce day service because of lack of volunteers. You know, but at the moment we're ensuring that we are maintaining service to a very high level.
And you're open here 16 hours a day. Have you had much sleep since this has broken out?
No, well, in fairness, you know, we have to give it to our volunteers, absolutely amazing. You know, everybody's come together. We've seen an absolute terrific response right across the country, you know, from the healthcare professionals to Gardaí to Army to, you know, but in particular, the guys that are on the front line that are providing our services are all volunteers. They have been here, you know, from early morning, 5 o'clock until 11 o'clock at night some nights, and then out on the streets at 2 or 3 in the morning. Our teams are working amazingly, you know, so they're doing a great job.
And what would you like to see the government do in response to this for the homeless?
My fear is that we are going to run out of stock very, very shortly. This does come from the European Feed Grant. We haven't seen a credit increase in terms of the allocation of this food. You know, and I would appeal to Minister Donoghue, appeal to Minister Varadkar to try and increase those allocations and ensure that we have the provisions. This is basic stuff on the ground that really is supporting people and helping people that are most affected in terms of losing jobs and those that are isolating. And we want to ensure that this continues and be able to support those in any way that we can.
Thank you so much for joining me here this morning. Now, we put a few questions to the Minister of Housing. They responded that they couldn't give us a number of an increase of beds, but they have said that more frontline staff have been allocated to this crisis. Thanks for joining me here this morning.
Thank you, Brianna.
Thank you, Brianna. Yeah, God, when we think of... We get caught up in it ourselves,
totally.
and you don't be thinking, like you're thinking, how am I going to keep the children busy? How am I going to cook a meal? And we're not thinking of the homeless and other very vulnerable people sometimes. You just...
But that's why I think that stat this morning is so heartening. 24,000 people said,
let me help.
I'll help.
Let me help.
I'll come back. And because they're medics, and these are people who have worked in the medical. They know the risk and they know the stress that's going to be. They know how bleak the next couple of weeks are going to be, and they're still saying, yeah.
I was listening to the radio